Hello, my name is LFelix, and I'm a student at Aspen University. For our Module 7 assignment, we were asked to discuss two common musculoskeletal problems, such as arthritis, fractures, amputation, and I selected amputation and systemic lupus erythematosus. So for amputation, it is a surgery that is performed to remove all or part of an arm or leg. It's typically done to treat injury, disease, or infection, and amputation may be recommended to relieve signs and symptoms of a disease and to maintain or improve the quality of life. Some diagnostic studies that can be performed are blood studies and wound cultures to assess for infection, vascular tests to evaluate arterial and venous function, and imaging to determine the degree of tissue damage. These are all tests to determine if amputation is necessary. Clinical manifestations of the problem. Most amputations are performed to patients with conditions such as diabetes, peripheral vascular disease, atherosclerosis, and vascular changes. But for a patient with diabetes, it can be due to peripheral neuropathy that occurs and that progresses to ulcers and gangrene. Some other causes may be trauma, thermal injuries, frostbite, infection, or cancer of the bone. Some interprofessional care that will be involved with somebody with this condition would be physical therapy, the surgeon who's performing the amputation, home care to ensure that the patient has the necessary assistance they need in the home, and rehab. They may be placed in a rehabilitation center to help them recover and just kind of get used to such a significant change in their life, because it's going to affect their physical, their mental health. An amputation can affect many areas of a patient's life. For treatment plan, the goal is to preserve as much of the limb as possible and preserve the functionality. Treat infection, and successful rehabilitation will really depend on the patient's physical and emotional health. So for medications, there are no medications that are specifically for amputation patients, but they may be prescribed some that are designed to treat the pain or symptoms that they can experience, such as phantom limb pain. So they may be prescribed anticonvulsants or epilepsy medications such as gabapentin for nerve pain. They will likely take some kind of pain relief such as over-the-counters, or they may be prescribed a narcotic. And then antidepressants may also help too if they're experiencing any mental issues, or that will also kind of help with that. And then for a nursing diagnosis, I said risk for impaired mobility related to the loss of a limb. The outcome will be that the client will verbalize understanding of their situation, why it was done, and that they will display willingness to adhere to their treatment plan. Some interventions would be to encourage the patient to perform any prescribed exercises, provide stump care on a routine basis, inspect the area, clean and dry it thoroughly, and instruct the patient to lie in a prone position as tolerated at least twice daily. For evaluation, it'll just be that the patient understands their treatment plan and is willing to perform those range of motion exercises and go to their follow-ups and understands the teaching that's provided. So just look for any signs of irritation. They must understand to look for any signs of irritation, redness, any foul odors. Avoid using any lotions, alcohol, powders, or oil on that limb. And if they are using a prosthetic device, to make sure that they're seeing how they're tolerating it and to discontinue it if any irritation develops. Now for systemic lupus erythematosus, so systemic means that it can affect multiple systems of the body. Erythematosus means that it's reddening of the skin. So what this condition is, it's an autoimmune disease that causes the body's immune system to attack healthy tissue, and it causes inflammation. It can affect the skin, joints, renal, hematologic, and neurological systems. Also, cardiology can affect your heart as well. And then there are periods of remission and exacerbation with this condition. The cause is unknown, but there are some triggers or factors, like risk factors, that can include a family history, contraceptive use, stress, sun or UV light, and chemical and toxin exposure. So for diagnostic testing, they'll likely perform blood work and see if there is a positive result for the ANA in the blood. And it's mostly, the diagnosis is mostly based off of the symptoms, so it is kind of a harder disease to diagnose because it has similar symptoms to other conditions. But the clinical manifestations, it depends on the tissue or organ involved, but some of the common ones are fatigue, fever, joint pain. A big one is a butterfly-shaped rash on the face. That one's a very distinctive symptom of this condition. Skin lesions that worsen with sun exposures, fingers and toes that turn white or blue when exposed to cool or stressful periods. And then shortness of breath and chest pain may also be some symptoms. The intraprofessional care, it just depends. It's tailored to each patient's unique symptoms, as this condition can affect many parts of the body. So some specialists that can be involved are rheumatologists, nephrologists, cardiologists, social worker, and a PCP. So for a treatment plan, again, it depends on the signs and symptoms, but medications can include NSAIDs. They can be over the counter to treat pain and swelling and fever associated with lupus. And anti-malarial drugs such as hydroxychloroquine that are used to treat malaria can help to decrease the risk of the flares. Corticosteroids can counter the inflammation of lupus, and if the lupus exacerbation is very serious, or if their case is critical, then they also may be prescribed immunosuppressants. Some interventions or nursing diagnosis for this condition would be impaired skin integrity related to exacerbation of the disease. The outcome will be that the client will maintain optimal skin integrity as evidenced by an absence of rashes and skin lesions. Interventions for nurses can be to assess the skin integrity, pain management, assess for photosensitivity, encourage adequate nutrition and hydration, and instruct the client to clean, dry, and moisturize their skin. So with that being said, the patient teaching, again, it'll just involve that the patient understands kind of what to look out for when they are having an exacerbation, and to make sure that they go to their provider when this occurs, and that they stay out of the sun as much as possible, avoid the triggers of the exacerbations, and just to maintain adequate hydration and nutrition. And that is all I have. Thank you.